Does a COVID vaccine cause myocarditis? If you have been following the headlines for COVID vaccines, you've no doubt seen this concern. And if you're like me, got worried by it. I am an emergency room doctor. I am a mom. And so I was worried for my patients. I was worried for my family and my loved ones and for all of you. And I really wanted to dig into the information, not to convince anybody to or to not get vaccinated for COVID, but to take the fear and the emotion out of it, give you transparent information to help you be able to be more informed and make decisions where you feel comfortable with your health decisions. So, with that, let's dig in specifically to COVID vaccines and myocarditis. Now, what is myocarditis? Quick thing. Myocarditis just means you have inflammation of the myocardium or the heart muscle. It is highest risk in general in males aged 12 to 30. So, for all of these statistics, I looked at those because we can then safely assume that all the younger kids will have lower risk. And that's kind of the worst case scenario. Now, so to answer this question, we actually need to look at three buckets. One is what is the rate of myocarditis just in the general population without COVID? Secondly, what is the rate of myocarditis after COVID vaccine? And thirdly, what is the rate of myocarditis after COVID? We have to be able to compare all those numbers. It wasn't easy, but I dug in and here is what I found for you. Now, in the general population, without COVID, without anything, just any given year, we see about 10 cases of myocarditis per 100,000 males aged 12 to 29 per year. 10 cases. Now let's contrast that to how much myocarditis do we see after the COVID vaccine. Now we typically see post-vaccine myocarditis is within the first 7 days after that vaccine dose, and it's greatest after the second dose, kind of that repeat dose. And what are the rates? Depends on what study you look at, but I want to share all the data with you so that you can help know the ranges. We see that it is anywhere from around slightly less than 1 per 100,000 people vaccinated up to 1.7, 4.4, as high as 15 per 100,000 vaccinated in one study out of Israel that you might have seen, and then even as high in one report as 35.9 per 100,000 people vaccinated. Now, contrast that with what is the rate of myocarditis after getting COVID. It makes sense that you could get myocarditis after having COVID because COVID is this highly pro-inflammatory condition. You get this very high inflammatory and autoimmune response, and you also get a very unpredictable one. So we see myocarditis after COVID for certain. And those numbers range anywhere from 55 per 100,000 infections to 100 to up to 132 cases per 100,000 COVID infections. Other studies look at kind of the relative risk, and they found that the relative risk of myocarditis after an infection is at least 2 times, but probably more like 6 to 16 times higher your risk than after a vaccine. So looking at all these, pulling it all together, it's clear that there's a general risk of myocarditis in the general population of males 12 to 29. The risk of myocarditis after getting a vaccine is around there or potentially slightly higher. But the risk of myocarditis after getting COVID infection is definitely higher than either of those two. One other thing to look at is how severe is myocarditis from infection versus vaccination. And again, not really large reports and numbers here, but from what I could find, myocarditis after the vaccine tends to be pretty mild. About 95% of cases were very mild. Myocarditis after COVID infection, again, since it is a large response, it is very unpredictable, tends to be more severe. Still, most people end up being okay, but there is about a 14% mortality rate according to one study. So, bottom line, myocarditis after COVID vaccine is less, significantly less than myocarditis after COVID infection. So, you are protected by getting that vaccine. And secondly, the severity of the myocarditis is less after COVID vaccine than after COVID infection. My recommendation in this age group of 12 to 29-year-old males who are at the highest risk is one, for them, I tend to recommend Pfizer. It has about half the risk of myocarditis as the Moderna vaccine, possibly due to a much smaller dose. But regardless, it has about half the risk. And secondly, as I spread out doses 1 and 2, we saw the highest risk of myocarditis was when they were 21 to 28 days apart. If you spread that out to 8 weeks, even potentially to 3 months, you're going to reduce your risk of myocarditis and based on some new information, might actually boost up your immunity a little bit better. So there you have it. Let me know what other questions you have. Follow us at TrueVlab to make sure you get all of our TrueVlab reports and don't miss a single one. Because taking out the emotion and the fear and giving you transparency of data helps you trust what you hear, be better informed, and have peace of mind about your health decisions.